So let's start off with a little introduction. My name is Sean Wheatley. I am a registered nurse, currently a student in the RN to MSN program at University of Arizona. In the next couple of slides, we're going to just kind of discuss and cover just patient care delivery systems, primarily focusing on microsystems, and also some areas or characteristics. And we'll get more in depth as we go on throughout the slides. This first slide, just kind of an overview. Microsystems are the essential building blocks of healthcare. By that, they are these smaller units making up the bigger macro systems or the bigger systems. So you have the big hospital, and building up that hospital, you have the individual units. So just some examples for some microsystems would be your outpatient clinics, your inpatient units. And so there are studies out there that have shown an association between the microsystems and patient safety and life quality. So they've also been known to produce quality, safety, and cost outcomes. They also are front line of care. So this is where a lot of the care is taking place. It's where the plans are implemented and change is tested. In the next couple of slides, we're going to be highlighting 9 characteristics or areas of a microsystem and how they impact healthcare delivery. The first area that I want to highlight is leadership. Leadership maintains vision, purpose, establishes goals, promotes an environment of learning, and nourishes positive culture. Leadership within a microsystem would have the responsibility to evaluate input and set goals to achieve the current vision and purpose, also implement change as needed. Leadership is your motivator, your advocator, and your mentor for the staff. So the leadership, I had said, it was nurturing the positive culture. That leads us into our next slide. Organizational culture and support. So culture, those are your values, your beliefs, and norms that govern your personal relationships or how people interact with each other. And as far as support, that's any kind of resources coming from your larger systems to enhance the work of the microsystems. So culture and support and how they impact the care. These two can have the ability to nurture and delay change or care. So if we break that down, if the culture is on the positive side, that means everybody's on the same page, we're sharing the same vision, this is being nurtured and fostered by the leadership, and we're able to accomplish goals and achieve improvement easier than as if we had some negative culture. If the negative culture is there, then people tend to not want to change, not to try new things. And so, again, leadership plays a big part in that. As far as resources, kind of the same thing. Resources and their availability kind of can hinder or promote any kind of change or any day-to-day work. The availability of these resources is provided by the larger system, so any of the macro system providing informational resources such as technology, equipment, etc., provides the support for the smaller system. The next area is actually 2 characteristics. It's both patient focus and staff focus. Patient focus, it would be our primary concern. It should be our primary concern and should be the driving force of these systems, but it is the primary concern to meet all patient needs. As far as staff focus, this is selecting the right kind of people. Patient focus in a microsystem should be paramount. Patient is the center, and the primary goal would be to meet all needs or whole patient care. Through providing information and education from treatment team, patients should take an active role in their individual care. This is just providing more patient-focused or patient-centered care. This is allowing the patient to actually have a say in their care, to be informed, able to kind of drive, if you will, the bus as far as where the care needs to be for the needs of the patient. As far as staff focus would be selecting the right kind of people, providing adequate training. Staff that feels empowered and useful tend to be more motivated to achieve goals. Interdependence of care team. This is trust, collaboration, willing to help each other, recognition that all contribute to individual. All contribute individually to a shared purpose. With a patient at the center, each member of the treatment team act independently to provide care and resources from their field. Members are to complement each other, where the output of one or the outcome of one can facilitate care from another, all to provide whole patient care. By this I mean, a nurse meeting with a patient, finding out new information as far as, abuse or dependence to a certain substance. That's when addictive disease counselors get brought into the picture, and they can play their part, as well as your doctors, your social workers, and therapists. It's kind of a team teamwork and a team-based treatment. The use of information in healthcare technology. Information is key. I started this slide with 3 words just to emphasize the importance of this area. Information in healthcare technologies is a very effective way for members of the care team to communicate, and communication is very important as well. This is where we eliminate a lot of our risks, med errors, repeated or duplicated treatments, ordering of non-essential tests. All of that helps bring down costs, better care, better quality of care for patients. Process for healthcare delivery improvement. Here is where we're going to be talking about the process improvement or measurable methods to improve the effectiveness and efficiency of service delivery systems, including as well staff or human resources. We'll monitor the care to provide measurable data. We need some kind of input to make any kind of changes. We'll compare our data with other leaders in the industry. So if we know that there is another hospital, another company excelling in a certain area, we can kind of see what's going on, and that is referred to as benchmarking. Also, we're going to empower staff to innovate. Creativity, innovative interventions from staff. So you have a large bank of knowledge there coming from people who are actually there getting their hands dirty in the front line, just kind of empowering them to come up with their own interventions. Staff performance patterns of everyday work. This is how we get our job done. Patterns are part of the 5 Ps. By the 5 Ps, I'm talking about purpose, patient, professionals, process, and then patterns. Again, I'll restate it. It is how we do the job. The focus should be on patient outcomes, avoiding unnecessary costs, and providing seamless care. If there was any area to target for any kind of improvement, I think I would probably focus on the area of staff focus. Just that this is a very large resource, and it is there available at the front lines. This would include continuing education, making sure that your staff is well educated and that education continues mentoring of the novice staff, and this would be choosing the right person for the right job, but not leaving anybody behind. We also want to provide the training that's needed, and so that all staff is at an optimal level of performance, and utilize individual strengths to strengthen the overall treatment team. So implementing or actually implementing any kind of improvement plan, it would have to be presented to the staff. I think the best way of doing this would probably be to present it to the staff in a way that they could relate the changes to their daily work, also providing any kind of expected outcomes and encourage any kind of feedback. So if we could relate this to their everyday work and kind of just showing them what we're looking to change and what we're looking to get out of it, possibly motivate them to see why we were making the changes, so it's not just kind of blind walking in there telling people, you need to do this and this is why. It's really just, this is what we're needing to accomplish. At that time, they can provide their feedback, since the staff do know what they need to do to get things done. As far as plan for success, monitor implemented outcomes. So any kind of change, let's see what change is being made. Provide scheduled updates on progress, so kind of inform the staff with the changes so far. This is where we're at. That's another kind of motivator for the staff. They don't think that they're doing nonsense or extra work, that it's actually paying off or not, and we need to make some further changes. We could also offer incentives. I know that there are facilities that I've worked for that have provided bonuses for achieving certain goals, and it's just a nice motivator for staff as well. And again, encourage feedback. There's a lot of input and knowledge there, and I would just encourage anything that would come back to better improve either the plan or what we're trying to achieve. So that pretty much ends my slides. There are some references there for you if you'd like to continue the research. But thank you for your time. I hope you enjoyed it.